First up today, a new study suggests COVID-19 cases may have been spreading in Wuhan earlier than previously thought. Released by researchers from Harvard and Boston University, the study examines a year-on-year rise in hospital parking lot usage at some Wuhan hospitals starting in August 2019. It also claims the rise in parking lot usage coincides with an increase in online searches for symptoms such as cough and diarrhea. But not everyone is convinced. Medical experts are already pointing out some holes in the research, and the paper has not yet been peer-reviewed. China's foreign ministry said the study has been widely circulated by some U.S. politicians and media as so-called new evidence of China's concealment of the epidemic. Why has the study attracted so much attention? What exactly does it prove? And what kind of political motivation might be fueling its popularity? I'm joined via satellite in Washington, D.C. by Eric Dean, epidemiologist and health economist at the Harvard Chan School of Public Health. We also have Victor Gao, vice president of the think tank Center for China and Globalization, joining us in Beijing via Skype. Dr. Dean and Victor, welcome to the program. Dr. Dean, let me first start with you. The paper, as we understand, has not been peer-reviewed. Let's have you briefly review the study for us. What was your reaction when you first learned of the report and its findings?
Yeah, the main finding was that there was an increase in search terms on Baidu related to cough and diarrhea, and there was a greater 90% increase in parking lot density around several hospitals in Wuhan. But those data are very circumstantial. If you were ever to, say, convict someone, you cannot just simply say, well, you know, he drove more often to a certain place, because those evidence are just very, very weak correlations, and there's many factors that can increase parking and driving, as well as internet search terms for very non-specific terms. So in many ways, it's not peer-reviewed, and my general review on it right now is those are really two strong conclusions based on this kind of circumstantial evidence.
Victor, before I come to you, I want to have both of you listen to this statement from a Chinese Foreign Ministry spokesperson. She has a statement on this matter. Take a listen.
The so-called paper is full of loopholes and fabrications, but some U.S. politicians and media acted like they'd found a hidden treasure and deliberately spread it, treating it like a new proof that China concealed the epidemic. I think this should be a new piece of evidence proving that some people in the U.S. deliberately create and disseminate false information against China. It should be unanimously condemned and opposed by the international community.
Victor, unfortunately, throughout the course of this pandemic, we have seen too many times politics get involved with science. Politics get in the way of science. Do you feel that this is another case where political motivations have played a part in the popularity of this study?
Well, first of all, I think for this study to come out of Harvard and with very low quality circumstantial evidence upon which very damning accusations are being based. This is shocking, and I hope Harvard University could have done better. And it's similar to saying someone has a heartbeat of 100 per minute. What does that mean? It doesn't mean anything. It could mean everything. So I think right now the tracing to the origin of the COVID-19 is becoming very much politicized, and there are certain forces in the world, in certain countries, which want to impose their version of the so-called truth on China. And China is very much against such falsified accusation, and China is actually welcoming the very open-ended scientific investigation, for example. But the investigation cannot be limited to one city or one country. The search for the origin of the COVID-19 virus should be really global. Wherever there is evidence scientists need to go to that place to see what exactly was happening leading to the beginning of the outbreak of the pandemic. And it includes the United States. I would say if the scientists at Harvard use the same methodology, they should have also focused very much on traffic decrease or increase surrounding Fort Detrick in June or July 2019.
Dr. Dean, I know you said just now that these correlations are weak. I do want to press you on one thing, on the methods applied in that research process. Primarily two aspects, hospital parking lot traffic and search engine data. I've seen members of the medical community call this approach interesting. I've seen them talk as a creative approach to understanding the origin of the coronavirus. But I think for a lot of people that have raised concerns and doubts about this study, the evidence and the methods all seem very simple, for the lack of a better word. Of course, we are the less medically sophisticated here. So for you, are there any merits to be observed on the part of the methods and the findings of this study?
I think in certain ways, the 90% increase in the parking is very interesting because that is much a bigger surge than normal. But again, traffic patterns can easily be swayed by many different things, and driving could have been increased for a variety of reasons. And so that evidence in itself is not the strongest. And similarly, cough is a very common search, and diarrhea actually doesn't really make sense. Only a minority of patients have diarrhea, and there's many other diarrheal diseases. So it doesn't mean that it's impossible. It just means, in my book, with great conclusions and accusations requires at the same time enormously strong evidence. And this is not one of those enormously strong evidence. And many other epidemiologists at Johns Hopkins and other places also kind of agree it's not the strongest evidence in the world. So we can't really base too much. And politicians are running away with it before it's even peer-reviewed. So I think that's going too fast and too far.
Would you say that these opinions and observations that you just mentioned are representative of the medical community in the U.S.?
I think this study has not been well received so far, and many other epidemiologists I've spoken with at other universities have been kind of shrugging their shoulders because we really don't know what to make of it. It is just very circumstantial. It just happened at the same time, but that itself is not enough evidence for, and this is not a political thing. Many other researchers, other universities agree. It's just too weak to really go all the way with that conclusion.
Victor, it's not a political thing to begin with, but it certainly has been made into a very big political deal. You as media news outlets certainly have wasted no time in reporting this new study, even though it has not been peer-reviewed, even though it's not been published by a medical journal. And as Dr. Ding just mentioned, other epidemiologists have also found the evidence in this study rather weak. Why do you think that this particular report has made so much splash in America, endorsed by politicians, retweeted by politicians? Does the title Harvard Medical School have anything to do with its popularity?
Of course, we know Harvard University in general and Harvard Medical School in particular are very reputable institutions, but the most reputable institutions can sometimes make very bad judgment or very inaccurate findings. So that's not surprising. I would say the danger is for someone to come up with a verdict and then try to find out the evidence to support the verdict. And this is exactly the danger going on in the United States. it seems that there are political forces which have already come up with a firm verdict against China, accusing China of the wrongdoing, and then they are very, very eager to find whatever evidence, valid or invalid, to back up their accusation of China. And this is the danger. I would say the scientific work needs to be done in a very serious and scholastic way, without any major inaccuracy built into it. And I think the search for the origin of the COVID-19 should be global, especially considering many important things happening in the United States in 2019, especially focusing on the closure of Fort Detrick. So I hope WHO will conduct very scientific investigation, including involving those incidences in the United States, to really dig out the true story of the COVID-19 virus. And the United States government should not stand in the way of the real scientific investigation into the origin of the COVID-19 virus.
Dr. Ding, I know this gets a little technical here, but I think it's pertinent to our discussion today. In understanding and studying the origin of the coronavirus, what are the traditional research tools that could be applied? Let's say if you were tasked with an assignment to examine the study of the coronavirus, would you use the same innovative, creative tools that have been piloted or that have been tried in this research? And what other traditional tools would you probably be more inclined to use?
I think we have to separate. There's different quality of evidence. Randomized trials for drugs and vaccines, and then there are longitudinal studies, and there's genomic evidence that links the DNA, the RNA of this virus and its evolution. I think that kind of evidence, trying to look for the origin, the original zoonotic origin, the animal origin, and finding that perfect match would be really, really good in answering that. And if we can't find a perfect match years on down, I think we have to also consider other factors. But I think evidence like this, where we can't even match individuals, specific viruses, just based on temporal coincidence in time, I don't think that is any good quality science. And I think any scientist in the world would agree on that. But at the same time, I want to get to the point of, searching for the truth, and that what the other colleague mentioned. There's also lots of other misinformation that the European Union, European Commission actually put out, that, that also there's potential misinformation coming from China and Russia around the coronavirus as well. So I think we shouldn't just simply point fingers and, again, throw accusations about Fort Detrick when there's absolutely no evidence for that. I could also make up, we should investigate X, Y, Z, but unless you have that actual scientific evidence, we shouldn't run ahead politically, just as we shouldn't be running ahead politically on this specific issue based on this one study.
Dr. Ding, I do want to end with you. What do you think doctors should be focusing their efforts on at the moment? Vaccines, of course, multiple countries are trying to develop a vaccine and to have it in the market as soon as possible. We do have some good news that maybe it will be available with the best estimate at the end of the year or early next year. What, in your opinion, should doctors and researchers focusing their efforts on currently?
Yeah, I think vaccine is obviously a very important area to focus on. And there's many groups. I'm glad not everyone is focusing on one specific vaccine candidate, that they're trying many different ways. But also I think we should find low-cost treatments, because drugs like remdesivir, it's nice that Gilead wants to donate 1 million doses, but that's a drop in the bucket in this global pandemic. And normally that drug is $1,000 per treatment course, and that is just not affordable for places like India, Brazil, Latin America, that has huge epidemics. We need to find more low-cost treatments and safer treatments. So I think we should expand our horizons beyond just these very expensive drugs that only a few limited people in this world can afford.
Dr. Ding, thank you very much. My thanks also go to Victor Gao. Thank you so much for your insight and your expertise.